Hello, it's Dr. Jeffrey DeSarbo again, and I welcome you to NeuroSeries episode 13 on the neurobiology of nutrition. Now, I have to say, as a psychiatrist, I'm not the one who typically works with clients on setting their nutritional goals and meal plans. That's usually left to the work of the nutritionist or the registered dietitian. So along the way, though, I've had the privilege of working with a lot of nutritionists and dietitians who kind of set those goals with their patients. There's a few common approaches to meal planning, intuitive eating, using an exchange system, and other types of different meal planning approaches. And it's usually dependent on the client and the nutritionist style and how they work with patients. And some nutritionists will work strictly on developing and helping maintain a meal plan, while others are also guiding patients on behavioral modifications and supporting the therapeutic and medical processes. Now, what I do want to reiterate here is that when you have anyone part of your treatment team, and especially the nutritionist, you want to make sure they are a specialist with eating disorders. It's not uncommon for most nutritionists to say, yes, I work with eating disorder patients. The truth is, most work with disordered eating and people who have medical conditions that require their nutritional guidance and meal planning support. But you want to make sure your nutritionist does specialize with eating disorders. So ask them about their experience, their training. Are they members of certain eating disorder organizations? Do they go to conferences? And maybe if you do have somebody you can ask for referrals with a specialist, that's a great way to find somebody who kind of specializes too. Like I mentioned before in NeuroSeries number 10, we always look at vitamin F, your food essentially, as being your main medication for eating disorders. But this talk here isn't about meal planning or types of nutritional approaches. It's rather about looking at nutrition and eating disorders from researched, evidence-based perspectives, and we want to look at the concept of food in general. So what is food? Food's simply elements and molecules arranged in orders that create edible objects to fuel ourselves and our bodies. And food can also have its romantic side, where it can bring us pleasure, and it can be something that we use as a cultural gathering and social norms, where we bring together people and family and share in events. And food also can work to stimulate different types of positive emotions, and sometimes we use food as medication to help us regulate negative emotions. But here we're generally speaking of food as being comprised of these molecules that make up macronutrients and micronutrients. And your typical macronutrients are the proteins, carbohydrates, and fats that you often see as part of food labels, and your macronutrients provide calories. And you need a lot of calories, kilocalories. And calories are really just a measure of energy, and that energy is required in large amounts to maintain the body's functions and carry out our activities of daily life. And it's not just that it maintains our body, but food and the calories contained within that energy is what is needed for each individual cell that's functioning in our body. So what you see here is a listing of some of the most common micronutrient deficiencies that you'll find with anorexia nervosa. And if you want to pause here, you can read more about how each of these deficiencies can have very neurobiological consequences, from neurotransmitter assembly to neuromodulation in different regions of the brain and creation of DNA and RNA. But ultimately, when you're consuming food and putting together a meal plan, you want to make sure you're not going to have any deficiencies during the recovery phase that will lead to complications with brain central nervous system restoration. And just to give an example here is vitamin B2, or riboflavin. It's an antioxidant for proper functioning of the immune system, and it's important for healthy skin and hair. And when there's deficiencies, as you often see in eating disorders, you get brittle hair, you get dermatitis, different itchy, flaky, dry skin, and a deficiency of B2 can be responsible for that. Now, that B2 deficiency also can have problems with the digestion of your macronutrients, your carbohydrates, proteins, your fats, that are, again, important to maintain the body. So riboflavin is necessary for normal development, lactation, physical performance, and reproduction, and it plays a major role in the transportation of iron in the red blood cells. So you can have problems with anemia, cataracts, migraines. You can also have thyroid dysfunctions with it, and you get changes in essentially how the brain functions and its cognitive processing. Now, what I do want to point out is with a deficiency in even one type of micronutrient like B2 is that it can lead to a cascading effect in the body. You see, B2 is also helps convert tryptophan to niacin, okay, other important components in functioning, which then activates vitamin B6, which is important for mood, memory, and confusion, as well as other physical conditions and like dermatitis and anemia and neuropathies. So you have a B2 deficiency, and it can lead to other problems down the road, such as B6 problems and deficiencies or inactivation of B6, and then we get more fallout. So one thing, again, seems to be connected to another. And then people often are complaining with multiple symptoms who have an eating disorder, not understanding the roles that each individual macronutrient plays in the body. And it's because of that change, again, in the brain and central nervous system. So when we talk about tryptophan here, there was a study conducted by Walter Kay and colleagues and published in 2003 of how it seemed like people with anorexia would unconsciously kind of be restricting foods with tryptophan that then showed that they had lower anxiety and depressive scales. And there's this theory that maybe it's a way of that restriction is a way of modulating certain components of food, such as tryptophan, to self-regulate mood. And there are more studies out there that look at, well, how can we consider tryptophan as part of the meal plan or as part of the therapeutic process to help people kind of through the recovery process. So there are people who are doing research on different types of micronutrients and their importance and how supplementation and restoration of entire meal plans leads to a better recovery status. And in past studies, I showed you how there's parts of the prefrontal cortex of the brain that seems to have extracellular volume in people with binge eating disorder when we watch that episode. In this study right here, it shows that there's this change in the neurons themselves. Those dendrites that kind of jut out from the main cell body of a neuron seem to be thicker and more dense compared to other neurons, especially, again, in that prefrontal cortex, which is responsible for often supporting and maintaining behaviors that are addictive and play a role in the brain's reward system. So you get this change in neuroplasticity based on certain types of foods in a certain diet that can alter how a brain is functioning and its actual neuroanatomy. So when working with people with eating disorders, it's not uncommon to come across patients regularly who say they're vegetarian. And a lot of times there's a very good explanation. They don't want to harm animals. It's a healthier approach to their lifestyle. It's fit in. What's interesting is this study that shows how people with eating disorders compared with controls have such higher rates of claiming vegetarianism. To ever have been a vegetarian, 52% of people with eating disorders say they have at some point been a vegetarian versus 12% of those who haven't had an eating disorder. To currently be vegetarian, 24% versus 6%. To be primarily motivated by weight gain in this study, 42% of the eating disorder patients said that they're primarily motivated by weight-related reasons, versus 0% in those who don't have an eating disorder. And when you look at different stages of recovery, you can see vegetarianism decreases. 33% of active cases, 13% of partially recovered, and 5% of fully recovered, which is closer to being currently vegetarian to the general population. So you have to really consider, when working with patients, what role is the eating disorder affecting food choices, including becoming a vegetarian or a vegan even. And most people, they looked at afterwards that they said their vegetarianism occurred, it started after the onset of the eating disorder itself, and that's 68% say it started after the initial onset of the eating disorder symptoms. So becoming vegetarian in the context of an eating disorder often and usually seems to be related to the eating disorder itself, although this is not always. And of course, people will often say, well, there's research out there that says having a vegetarian diet is healthy and prolongs life. And in many instances, that can be the case, especially when people are prone to or have certain medical conditions such as diabetes or heart disease. But also, it can pose a risk when someone is dealing with a condition such as anorexia nervosa, or they have comorbid behaviors such as excessive exercise. So it has to be carefully dealt with, to say the least. Of course, certain micronutrients such as B12, cobalamin, is often low in many eating disorders based on dietary intake because it comes primarily from animal-based foods. And B12 is found in very trace amounts in plant foods. So if one is a vegan or vegetarian, B12 becomes an essential micronutrient that has to be added through supplements or fortified foods. And deficiencies otherwise can result, and things like anemia, blood cell changes occur. B12 plays a role in the health of the neurons as well, and deficiencies there can lead to a decrease in the formation of that important myelin sheath that surrounds our nerve fibers. And I showed that in some of the other slides, kind of that bilipid cell member that surrounds that electrical firing off of that nerve fiber. And when you get holes, you get these kind of altered nerve transmissions in our brains and central nervous system. And so you end up with low moods, low energy, fatigue, difficulty with attention, focus, memory problems. That's all commonplace. And being a vegetarian on top of an eating disorder brings with it some extra complications that need to be contended with, often primarily with the work through the nutritionist who understands this, as well as understanding it from a medical and often therapeutic perspective as well. And I remember being at a conference, and I was listening to one of my medical colleagues give a talk on the medical aspects of treatment and recovery. And he said he never fully saw a patient recover, who 100% recover from an eating disorder if they remain a vegetarian during the treatment process. It made me think of all my clients, and I ended up thinking about it and kind of agreeing with them. And I thought many have come a significant way, close to full recovery, but maybe only 80 or 90%, but not 100. Now, I'm not saying it's impossible. I'm just saying I haven't seen it, and my colleague hasn't seen it, and certainly it makes things more difficult. But we both did talk afterwards, and we said we have had patients who were vegetarians or vegans going into treatment, and they kind of then expanded their food selections and varieties and started including some animal-based sources, and then found themselves going into recovery, staying in recovery for a period of time, and then going back to a vegetarian lifestyle, and were able to maintain a healthy lifestyle without an eating disorder present. Kind of saying it's like if you want to be a vegetarian, that's great. It's not great if you're going to do that through recovery. But people are often, and especially the stronger an eating disorder is, very reluctant to kind of consider changing that lifestyle, even though we're all looking at it as a medical change in what we're giving the body. Going back to to that your primary medicine is your food, and we can't give you all the medicines and certain types of foods that we can give you as well in others. So remember, recovery too is not just about restoring weight. It's not about stopping behaviors. It's about getting control of your thoughts, not constantly thinking about food, weight, body image, or having a terrible eating disorder voice telling you how undeserving you are, how hard things are, and it's about having a peace of mind. So if we look at recovery from that perspective and 100%, we got to look at food as medicine, and can the foods give the body all the meds it needs for full recovery? Another reminder slide that, we kind of need everything possible as far as macro and micronutrients to keep that metabolism firing so that the brain fires off the way it should and doesn't go into this hypometabolism phases in the whole brain or in parts of brain regions that gives us difficulty in functioning. And this study looked at the brain and how it seems to normalize with weight restoration and anorexia nervosa. Once you give it everything it needs again, it goes back to the way it's supposed to be. There's a study does show there are some regions that sometimes take a while, like the parietal lobe seems to take a little bit longer than other parts of the brain to fully restore. And if you remember, I've also discussed in prior episodes how the parietal lobe can be responsible for things such as body image and tolerating body image. So even when working with patients, I can say, body image often is one of the last regions that kind of gets better in the eating disorder process if one is struggling with that. And that can be related to, again, the metabolic normalization in certain regions of the brain. Now, one thing I do want to kind of give an example of, and the importance of having the right clinicians and understanding refeeding, is in studies such as this, and this isn't the only one, there's many out there, but this is an example why you need a specialist in eating disorders. With conditions like anorexia, people think, well, it's about weight restoration. If a patient has a very low body mass index, very low body weight, they simply need to regain weight, and the faster the better. But the truth is, nothing can be farther from the truth. There's something called Refeeding Syndrome, and it can be fatal during weight restoration if a nutritionist or a physician is not aware of its potential or is not aware of a person suffering from their eating disorder. And refeeding syndrome is when you get these fatal shifts in fluids and electrolytes in malnourished patients. And these shifts result from hormone and metabolic changes, and it causes these changes in the body's electrolytes. You get low phosphorus, you get changes in sodium levels, changes in glucose, protein, fat metabolism. You can end up with thiamine deficiency. You get low potassium, and you get this low magnesium as well. But in refeeding syndrome, one of the most dangerous things is you get this whole body depletion of phosphorus. And it's related to changes in how the body releases insulin during the refeeding process, and that causes a significant uptake of the element of phosphate in cells. It gets kind of sucked up, and this leads to changes in phosphorus, okay? And when you get these even small decreases in phosphorus, it can lead to just system-wide in the body dysfunction in cellular processes in almost every single physiological system, and especially the cardiac system. And people can have cardiac arrhythmias and even cardiac arrest. And that's an example why it's dangerous when you have a non-professional who doesn't have the understanding undertake a treatment, meal planning, weight restoration without expert supervision. So when you do look at it and you get nervous, well, who's at risk for this refeeding? Now, the most people at risk usually have a body mass index under 16. They had a weight loss of like 15% in the past 3 to 6 months, little or no intake for 10 days. They already have low levels of potassium or low levels of phosphate or magnesium before the refeeding starts. But it can occur in patients who have who have lesser criteria than that, and they fell into refeeding syndrome. So specialists need to know signs to detect when it's occurring. That's why eating disorder specialists work with a team of nutritionists. and the nutritionist is often consulting with the physicians who are monitoring for the medical stability. And when risk is present, the initial phases of refeeding have to be done sometimes in a hospital setting where they can be under constant cardiac monitoring and have frequent blood electrolyte labs drawn. So physicians and psychiatrists have to be aware of this, because if you get an EKG arrhythmia finding, such as a prolonged QT, which is mentioned in this article, it's also relevant to us, as a lot of medications that we use with patients and eating disorder patients can potentially have a side effect of also prolonging that QT interval on an EKG, which can worsen the risks and complications from the refeeding. So that might sound complicated. If you want to listen to it again, fine. If you want the take-home messages, even refeeding a patient can come with significant cardiac risk in some patients. And it's funny because I always say find a specialist with eating disorders for nutrition. And if you ever want to know if your nutritionist is a specialist, ask them what refeeding syndrome is and how they monitor for it, and see what kind of answer you get. Because it's a common risk that has to be observed when working with many people with an eating disorder, especially anorexia nervosa. And again, that kind of goes back to analysis that kind of like the longer a person does have an eating disorder, what we're saying is you're kind of not getting the medication through the vitamin F that you need on a regular basis. So, and those macro and micronutrients are medications that we need so that we don't develop health risks. And the longer that continues in life, it's like taking a necessary medication, but forgetting days all the time. It will shorten lifespan. So getting treatment, getting it right away is very important. Food is a medication, okay, which is totally different because most people are taking their vitamin F every day as needed. But with an eating disorder, there's a lot of people who are not getting what they need on a regular basis. So again, a slightly different view on the neurobiology of nutrition, but there's a lot of stuff out there if you want to hear how nutritionists want to essentially put together a meal plan and work with eating disorder patients at their level. So I invite everybody to continue on to NeuroSeries 14, the family support system. We're just going to try to give you a little bit of guidance of things to do, what not to do, what to look at if you're just starting working with someone or you've been dealing with an eating disorder yourself or with a family member for a while. Again, it's Dr. Jeffrey DeSarbo, and I thank you.